So anytime I hear a patient present with numbness and tingling into the arm or the hand, I start to think about something neurological. Is there pressure being put on a nerve? For instance, like if a patient complains of achiness, tightness, dullness, I'm thinking more of a soft tissue injury, might be irritation to a joint, but the numbness, the tingling, shooting type of complaints, it leads me to believe that there's some irritation of a nerve potentially. And first off, I want to take a detailed history with the patient. Was there trauma involved? How long has this been going on? What exacerbates it? What makes the condition worse? When I rotate my head to the right and extend back, okay, now that indicates that there potentially might be a problem in the neck. What makes you feel better when I rest, my arm up on my head or whatever position I may get in, different things like that. So the history is so very important. It gives me so much information as a provider on, I'm able to start making an assessment of what the problem may be potentially before we even get into the exam. So, we talked about there's possibly a neurological issue. It starts I develop a roadmap from the history. Then we get into the physical examination. We have certain orthopedic tests. An orthopedic test is something that we're going to do that once again kind of gives us a differential diagnosis. And the exam, I always say it's the most important visit because we need to figure out what your diagnosis is. And what I mean by that, we need to figure out what your problem is. And you as the patient, you have a good understanding of what your problem is and what the options are to fix it. So these orthopedic tests start to kind of build more of the picture, more of the story for us. And then from that, if we are, suspicious that, let's say, I think you may have a cervical disc bulge, okay? And so the disc is the spongy thing in your neck. Sometimes that disc can bulge, protrude, puts pressure on a nerve, and from there it may contribute to pain down into your arm, your hand, numbness, tingling, those types of things. Many times, patients will do a specific activity over and over again, whether it's I'm on a computer, I'm on a device, my head's looking down in deflection. So it's many times repetitive type injuries, I call them cumulative type injuries, can contribute to these disc bulges or herniations. Unfortunately, and obviously, trauma is something that we deal with, whether it's a sport accident, any type of traumatic event that would put a lot of pressure and irritation on this disc that would put pressure on the nerve. So the first thing that I'm going to look at is the problem coming from the neck. And from there, I just start working downstream, okay? We have a bundle of nerves that that exits through our armpit. It's called the brachial plexus. It's possible that we'll have irritation of a nerve root there in that brachial plexus. Once again, that will reproduce numbness and tingling. And then we're gonna work down into the elbow. I saw a patient yesterday with irritation to the ulnar nerve. Okay, the ulnar nerve is on the inside of the elbow. It's going to innervate the outside here into our pinky. So you can have entrapment or irritation of these nerves throughout the elbow as well, which will kind of tell more of a story and lead us to believe where the numbness and tingling is coming from. And then obviously carpal tunnel, we're all very familiar with that. That is irritation of the median nerve in your wrist. Folks that are doing things, repetitively, once again there, playing guitar, different types, jobs that, require us to move repetitively and over, it can irritate that. And from there, you're obviously going to have just numbness and tingling in the fingers and the hand. Back on diagnostic procedures, we talked about MRI is a standard for disc irritation and protrusion, but there's something called an EMG or an NCV. It's a nerve conduction velocity study. And what that is they're able to use needles in different spots, and they can take readings to make further determination, a more comprehensive diagnosis, if you will, where exactly that irritation of the nerve root comes from. Because as a clinician and you have pain down in the arms, just like I spoke about, there's a host of things that can be contributing to it. So for instance, if you have right arm pain and we get an image or an MRI of your neck and it's clean or unremarkable or negative, we need to do further testing to determine where that irritation is. And so once we make that proper determination or diagnosis of where the irritation is potentially, then we can recommend the appropriate treatment plan. I talked about diagnosis is so very important as a patient to understand, and from there, what are the options? Okay, as we're always going to start with conservative options if indicated. Is chiropractic therapy an option to potentially get pressure off the nerve root? Do we need some form of physical therapy to stabilize around that herniated disc? Is there an ulnar irritation, brachial irritation? Is deep tissue massage, active release therapy? Is there some way that we can release the tissue to reduce stress and pressure on the nerves? High intensity laser, okay? We've had fantastic options with median nerve irritation, reducing pressure to that median nerve related to carpal tunnel. So, once we get that appropriate diagnosis, then we can talk about a sensible treatment plan moving forward. Obviously, other conservative options, medication management. If your provider thinks a steroid or some form of anti-inflammatory would be a good option for you, that could be indicated as well. And, the most aggressive forms of treatment are going to be the surgical options. If you have an ulnar nerve irritation, they could do something called a transposition where they actually move the ulnar nerve. Carpal tunnel surgery, a very simple surgery, recovers very quick. Cervical surgery, potentially maybe clipping or reducing the size of that disc. In extreme circumstances, they might have to remove that disc and put hardware in. So multiple surgical options as well. We're always going to, if indicated, we're always going to want to start exhaust all our conservative measures first and then proceed as necessary. It's all based on results. And so remember, there's a host of things that can contribute to numbness and tingling down into one of your arms or hands. Numbness, tingling, shooting, sharpness, typically an indication of irritation of a nerve, okay? Could be a problem in the neck, the armpit, the shoulder, the elbow, the wrist. Different forms or options for us: physical therapy, injections, medications, and then ultimately surgery. So I encourage you, if you do have ongoing numbness and tingling into one of your extremities, it's not resolving, it's getting worse, I suggest that you get it checked out appropriately and make a decision on treatment from there.